Okay, good morning, everyone. Welcome to February 2nd, 2022. So 2222. And I've been told there's another 22222 coming up this month. So it's a lot of twos this month. So welcome to our client entry webinar. Thank you for joining us. Those of you new, we record this webinar. We do it every first Wednesday of the month. We record it. For those of you who can't make it all the way or get called away for some emergency, these things happen. And then you can review it on our website. Usually takes a day or two to get it out there. With me are currently Jody and Justin to help me out during this presentation. You have seen a little pop-up menu when you joined. And on that menu, there's a small box that says questions. And you can use that to type in any of the questions that might pop up, and we hopefully can answer them. And if we think it might be interesting for everybody else to hear the question that you might have, then we bring it to the floor and might discuss it as a group and try to inform you as much as you can. So, okay, that's a little of the housekeeping, and then we get to slide number 2. Purpose of why do we keep these webinars? We have them every Wednesday, every first Wednesday of the month, and unless some unforeseen circumstance. But we do these to provide information if there are any changes or enhancements. And we know there's always something going on. There's some story in the rumor mill that something is going to disappear or come, or the next amazing thing is coming up. So if there is anything, currently we're in a bit of a status quo, and there is some discussions about the MOTS replacement, but that's still a few years out. So don't worry about anything yet. There's nothing really going to change quickly. So there's not much changing in the system that's been going on for almost 9 years now. And it's doing pretty good. And we got most of the things covered, but you never know. Sometimes there's a federal or legislative change that requires us to adjust our systems that we have. So, and if that does, we'll let you know as soon as we can. And as soon as we have solid information. Discuss data issues. That's one of my favorite topics. We get a lot of information from you guys, and we put it in our systems, and we try to learn from it. And one of our goals is to get the best data we can. So sometimes there's issues about things that are a little confusing, or we get the feeling that people are not truly understand what's going on and what we're looking for, or what kind of information we're trying to get from the data. So we bring it to the floor and discuss it here. So also, this is a great place for your feedback. If you have any questions, something that popped up or something that's been nagging or bugging you for a while, you can put it in here, and hopefully we can help you and discuss it and talk about it. If it is something that is of substantial size, then maybe we put it as a topic on the next webinar. And everybody else can, and you can give us your input, give us your information, and we can discuss certain items, certain things that you think will be helpful. And again, as I said, hopefully we can answer all of your questions. Okay, let's get going. Get back to, did Lyle show up? Let me do a quick check.
I'm here, Pete.
Oh, there you go. Excellent. Thanks, Lyle. Okay, well, then the next slide is, and the microphone is all yours.
Great. Good morning, everyone. So the Cold Fusion update is out. I know we've been promising for a while, and there were some slowdowns, but the MOTS web portal, the old version, is now gone, so it'll redirect you to the new location. The new link is right here ahead of you. You should have all also received a communication about it. So we have a Cold Fusion update. So while Pete says our system may never change, we always make sure that we keep it up to date. And this was one of our big keeping it up to date processes. You know, I know we promised it months ago. We did notice it had some issues, and we weren't going to launch anything that wasn't the exact same thing as you've been using. And now here it is, error-free, ready for all of you.
Excellent. Thank you, Lyle. Okay, the next slide is about administrative burden, and that's been something we've been talking about for a while, and that started going on in the summer of last year when our whole COVID stuff got really out of hand, and there was a lot of trouble with the workforce and people being able to do all the tasks and people coming and going. And I know there's a lot already. In general, there's quite a bit of turnover within our organization. So this time it's gotten even worse. So the workforce crisis was really taking a toll. So one of the actions that Oregon Health Authority took for the last 3 months of the year was a pause on updates, not on submitting data. We want the admissions and the discharge. So definitely keep doing that. But we have our thing that we'd like to stay in touch and see what's happening during treatment. So every 90 days, an update was required. So we did away for that for a while. The other thing was a pause on mental health crisis, which is a special section in MOTS. And if you were doing that, then you don't have to do that anymore until we tell you to start doing it again. So that was gone for 3 months. And the beginning of the year, there was no real thorough and loud and clear announcement, but from what we've understood is that at least another 90 days, so through the end of March, or maybe even through summer, maybe 180 days. We have not heard a definite yay or nay on that one. So the updates, you can still hold off on those, and crisis, you can still hold off on that. For those of you who are going to EDI or thinking about EDI, please don't spend any money and don't change any of the processes that you have. If things are being set up and if it's working, if it ain't broke, don't fix it, is a good saying, especially in this situation. So one exception though, the crisis events, if that is a separate process that takes extra work, then it can be stopped. If it's an automated process, part of the whole, all the routines, then just let it go. So that's the current story that we have. If there is any change, and legislative session started, so who knows what's going to happen. Upper management might all of a sudden decide, no, we really need them again, and then we'll let you know. Or they might say, no, we'll just let it hang for the summer until everybody things are mellowing out and coming back to normal a little bit. So that's what I wanted to tell you about that. And then I'm giving the floor to Justin, and he's going to talk about anomaly report corrections.
Thanks, Pete. Can you hear me okay?
Yes, you sound great.
Okay, good. So in the first week of January, many provider agencies received one or more anomaly reports. We've talked about this a few times. Again, the anomalies are just data that looks a little odd, might be wrong, and we're asking you to check it and tell us whether it is wrong or not. We got some questions regarding what to do with those reports. So this is just kind of a summary. There'll be details in the January MOTS Messenger if you'd like to look at those. But if you need to respond to an anomaly report, you can just reply directly to the email. Those have been coded to reply directly to MOTS support through our secure server. If you get an anomaly report that has data and you have confirmed that it is correct as entered, then we need to hide those anomaly notifications. And the best way to do that is for you to send us a list, maybe the original spreadsheet with some notes added, or a separate list in an email message or a document. And just let us know that this is correct, you checked, it's fine, and then we'll add a filter to hide those. If you've got a locked field that needs to be changed, and that would be last name at birth, date of birth, admission date, or client ID, then MOTS support needs to make the change for you. Easiest way to do that is to pick up a copy of the data corrections request spreadsheet from our website, fill that out, and send it in to the MOTS support email address. But then there are other fields. There's legal status, arrest counts, marital status, that sort of thing. If those fields need to be changed for an active client, the best, and in fact the only thing to do, is to log into MOTS client entry, update the record, and click submit. This will count as a status update and will make the correction in the MOTS database, and then the anomaly report won't catch that anymore. If you've got data in those other fields that needs to be changed for an inactive client, unfortunately, there's nothing that can be done about that. That data has been locked. But still, please let us know that you've checked and it can't be fixed, and then we can still hide it from future anomaly notifications, just like if it was correct as entered. I think that's all I have on this one.
Excellent, thank you. That was loud and clear. Thank you, Justin. Okay, then we go to Mary, who called in sick today. So she was going to talk about MOTS support services. It's one of those websites, one of the mailboxes that we tell you if you have any issues, if you're not sure about something, always MOTS supports is there to help you. Just mots.support@dhsoha.state.or.us, and we have it memorized. I'm pretty sure that plenty of you have it memorized as well. So,
And Pete, I use this every day if you want me to do this one.
Sure, go for it.
So Mary and Cecilia are the main part of MOTS support, but I'm always that higher level of triage that comes out when you have a very technical question. But we are here to answer all your MOTS questions. So if you have a simple one like a lockout, or you need more accurate information or receive suggestions about improvements, those tend to go to me. But if you can't log into the system or you need help with an access issue, that's usually where Mary and Cecilia help you. We create custom reports and data extracts. That's actually Justin, who could speak more to that. But right now, I'll just say if you have a report need or a data need, I would send that report to Justin. MOTS support can make changes to locked fields, dates of birth, last names at birth, client ID, and dates of admission. So we have a form that is sent out, and you fill that out, send it back to us, and we make sure that gets worked. We reset your SFTP password. So MOTS has 2 levels of protection, which means if you find yourself locked out of MOTS, you will need to call the help desk and get your PIN number password reset. However, we have work on our own end to make sure that you can access our own system. So kind of think of it as your PIN number can get locked, but then you can also get locked out of MOTS itself, and we can give you that MOTS access, but we can't do anything about that PIN number. And then we can change last name, first name, or middle name. These are not locked fields, and users can change these as needed. And yeah, we can reset the web portal passwords, which I had already mentioned. So that's the work we do. And, you know, if something outside this list comes up, but you have any questions or you need support from MOTS that you don't feel I mentioned here, please just feel always free to reach out to MOTS support, and we go through that inbox and we make sure we answer all your questions and help you the best we can.
Excellent. Thank you, Lyle. Let's go back to the agenda, and then it is Justin who has some info about Oregon driver's license and the SID numbers.
Yeah, it's not very often that we have to let you know about a bug in the system, but we have a bug in the system.
No!
On the behavioral health page, we have an Oregon driver's license field and a SID number field. Sometimes those show up as required, but most of the time they're optional. In any case, the fields can currently not be cleared. So if you've got a number in there that doesn't apply to the person, it was entered in error, doesn't apply to the person anymore, whatever, it's not possible to get rid of it. You can click in the field and erase the number, and it'll look like it goes away. And you can click submit, and there will be no error message. But if you go to look at that screen again, the number that you had previously cleared comes right back. We've reported this to our application developers. They are investigating it as a bug. They may not be able to fix it with the current resources that we have. Looks like this one's quite a bit more complicated than it looks at the surface. So for now, if you need to clear an ODL or a SID number, best thing to do, send a message to MOTS support. We just need the client ID and which field or fields need to be cleared, and we'll keep track of the changes that you need done, and if possible, we'll apply them as a database fix once the problem is resolved.
Excellent, yes. And I was just bragging at the beginning how great a system it is after all these years. And after all these years, we find a bug. Okay, thank you, Justin. Are there any questions that are popping up that people have that we should bring?
We've had one come up from Rebecca, question about being able to get into MOTS. Apparently there's a problem with the page loading.
And that is the new link?
Using the new link, yes.
Oh. If you have issues like that, I always recommend to send an email to the MOTS support, and we can look into it, because sometimes it's a browser issue, a cache issue, or sometimes it's an organization issue that needs to clear the firewall of your organization. I've had that with the Oregon Youth Authority. They received a new link and said it won't let me in. And we know that is a pretty secure organization, and they have individuals at their IT department that are in charge of the firewall and of the links that are allowed on your computer. So sometimes if an organization is pretty tightly closed and the firewall is set up, then maybe somebody in your IT department needs this new link added to the list of allowed links, and then you should be able to get access again. So that might be the case. That's one story I heard. But if that is not the case, please let us know, and we will always be available to help you and try to sort things out and figure things out. So that was the one thing that popped in my head. Okay, the next one is who is who. And who is who has two pieces. 3 slides actually. The first one is who reports in MOTS. And going back a little bit to what I told at the beginning, that there's quite a bit of turnover, and especially currently with the issues about the general workforce problems that the most of us have, is that I thought I'd reiterate on who reports in MOTS. And it's a lot of text on these next couple of pages, so I'll give you some time to read through it and help you just read them out loud so you can kind of get them in. So in general, an e-behavior health provider who is licensed or has a letter of approval or certified from the Health System Division or the former Addiction and Mental Health Division, AMH is what we were called, and receive any public funding to provide treatment, then you are required to report to MOTS. So providers with Health System Division contracts that deliver treatment services like CMHPs and LMHAs, or providers that are subcontractors of the CMHP or HSD/OHA, mental health organizations, or CCOs. Those are all different organizations that have to report data into MOTS. And we'll get to who do you report in a little bit. This is just who needs to report. And there's another one that is providers that HSD does not contract with, but are required to submit data to MOTS by the federal statute. And those are the DUII or synthetic opiate treatment providers. They are federally required to report all their clients to MOTS. We get that information and we report to the federal government. And then one more, the providers that contract with other governmental agents. I mentioned it earlier, Oregon Youth Authority, and the Department of Corrections. So those are the organizations that should report in MOTS. And then a lot of more text about who do you report. Well, data must be reported for all substance use disorder clients in the providers and facilities that are licensed, as I mentioned earlier, regardless of client funding source, federal block grants, Medicaid, private insurance, self-pay, free care. Well, there's no real free care because it's usually assigned to some general fund. So all those individuals need to be reported. And then for all mental health clients who receive mental health services from the programs operated by public funds. And we have the following guidelines, and they should all be observed. There's 3 of them. So you have to include all identified persons who receive mental health and support services, regardless of service setting. The reporting should cover all service types, including screening, assessment, and crisis services. Although we can take a little break on the crisis services at the moment if it's extra work. So. But this also includes identified clients receiving only telemedicine services. We have the new procedure codes for that, and they are included these days. So. Also include all persons with mental illness or co-occurring mental illness who receive mental health and support services that are funded by Medicaid or under the auspices of other public funding sources. And then one more of the guidelines that needs to be observed is include any other person who are counted as being served by the OHA or come under the auspices of the OHA system. This includes persons served under Medicaid waivers. So, and I know it's a lot of text, and that's why we record these, and you can review this one more time. And I see some questions pop up, so I go one more time. The next page, the final page on this thing, is we have a little graph, and it makes it a little easier for most people to see it, to visualize it. You just start here, you take this chart, have it as a card, and you ask the question, is this a Dewey or methadone? And if the answer is yes, always submit the MOTS, no matter the payment. If it's not Dewey or methadone, so you should know, then you check, is it substance abuse client? If it's substance abuse, yes, submit the MOTS no matter the payment. Is it a crisis or involuntary services? And if the answer is yes, submit the MOTS no matter the payment. If the answer is no, then you can check again, and you check, is it mental health treatment full or partly funded by Medicaid? If there's any part of it Medicaid, submit the MOTS. If the answer is still no, so yeah, no, 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 then the reporting in MOTS is not required. And that's still a fairly rough guideline for everybody. I know there's minute details and tweaks and exceptions to rules, of course. Whenever there's rules, somehow, somewhere, somebody will come up with an exception to it. So, but this is roughly the guidelines that we have, and we've been told that it's been very helpful to use this chart, to have this graph on a little card somewhere printed out or on the wall in an office, that it's a quick walkthrough. Say, oh, this, yeah, okay, there. Yes, 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 no, yeah. Oh, as soon as there's a yes, then you submit the MOTS. So, any questions popped up about this? I'm guessing they usually are. Or is it about something else? No, that was it. Cool. Okay, then we go back to the agenda. And we have Jody, who talks about switching from CE to EDI. Go ahead, Jody.
All right, thanks, Pete. All right, can you hear me okay?
You sound great.
Okay, great. So yeah, we know with many of the ever-changing landscape of behavioral health and what we do, that there's always changes that are happening, especially the last couple of years. Organizations have been finding different ways to do what they need to do more efficiently or differently to fit their needs. So we know that some of the people or providers that submit through client entry look at new EHR systems that want to switch to sending their data electronically. So if you decide that you are thinking of changing your data submission from client entry to EDI through one of your EHR systems, just let us know of the change, or let us know if you're thinking about it, just things that we can prep up, make sure our teams are ready. We have people and resources available to assist as needed with this process, because there will be some involvement with us. Number two, the electronic health records and the MOTS functionality. There is really no one way or right way to collect data or to send data to MOTS other than it being in the correct file format to meet our specifications. So when you're looking at different systems and you're checking out the MOTS functionality, because oftentimes that's important, they want to send it electronically, a few things to maybe ask when you're looking, or if you've picked one, just to understand it better. That is, what is the process, the actual business process for this functionality? How does this work? Like from the time a client comes into your organization, into the system, to it actually being submitted in the file to MOTS? How much time will be required? And who will do which steps? Again, there's no one way that's better than another. There are just differences in workflows. And it's important to know those so that you still allocate enough resources of staff and time to do the different new steps that are involved in the process. Maybe ask for a demonstration if you're looking at different systems so you can actually see it from start to finish. Some organizations have done that. It's been really super helpful when they're looking at new systems. Or maybe they're looking at a new platform of their existing system that can do it as well. So moving on to number 3, project timing is super important. We want to make sure we can help you see your project to success. So that kind of ties with number 1, letting us know we get the project timing down. Number 4, we have a process for changing your data submission. We will go through that with you as you move from client entry to electronic data, EDI. There is a secure file transfer protocol setup. It's kind of a little alphabet of words there, but you may hear SFTP as an acronym, and that is just a location on our servers here that allow you to connect, or your system to connect, and to drop off and pick up your files. So it's kind of like your own little postal box here that you connect to and send and exchange data and information. So that's a really important piece. Number 6, we talk about client ID considerations. Your new system, if you're getting a new one, might assign numbers, and those may or may not be in alignment with what you were using before. So there's some processes to update those, and we work with you on that. Number 7 is kind of internal to your organization, but it's helpful if you define your process for who's going to be doing what and which steps of your data collection and submission to MOTS. We're going to test your files. Now, you may be getting a system that is already submitting to MOTS with other customers. We do test and certify at your provider level, not at the EHR level. And the reason we do this is because there's so much customization and different ways you can set up your EHR that may be different from another customer with the same product, is that we want to make sure that your setup and your special design or whatever you've done still meets with the formatting standards for the file itself. Sometimes there's just different codes or mapping, and we just want to make sure that is correct. So just know you will do testing even if you go or you select an EHR that's already sending data to MOTS successfully. Number 9, you're going to go live, which is the super exciting part. And then number 10, we're going to do some follow-up. And typically follow-up is after you're live, and it's just whatever frequency of meetings or touch, check-ins that you would like. But it helps depending on how your system works. If you've got questions on kind of the flow as it's going back and forth, or maybe error messages, different things like that, we can make sure and carve out time for you. So with that, I think that kind of covers my information here. Did we have any questions, Pete? Or I guess one last thing I would just say is, go ahead, Pete.
I saw one question from, I think it was Alicia Adams, about changing, no longer using OWITS and going to a different system, and they are in transition and they think they are curious what's going on. So I think I recommend Alicia to contact MOTS support or Jody directly to find out what's going on.
Actually, Pete, I've got that in progress. I'll be in touch with them later today.
Oh, excellent. Cool.
But we did have a question from Sarah, kind of a follow-up to your previous slides, Pete, about reporting substance use clients who have Medicaid and or DUI. She says, we've only been reporting substance abuse patients who have Medicaid or DUI, understanding that we need to be reporting all substance use clients. Was that a recent change, or was she misinformed?
I think she was misinformed.
Yeah, and we're sorry about that. And you're not the only one to be confused and that are missing that data. So, don't feel too bad. Just make sure in the future that we get all of that data for all those clients. And if you have any client data that you could submit for your old clients, we would definitely take that. But you're not the only one to be confused by that. We go over it in the training, but sometimes I feel like we data overload you in the training, and then these small things get missed. But that's why we have these webinars. And so just don't worry too much about it. But go ahead, Jody.
Oh, and just another, just kind of a note on that is that, if you are an existing organization or you've looked into this or you're new and you've got questions about this, definitely, again, reach out to MOTS support and we can carve out a 30-minute window or whatever works and kind of talk about your organization in specific and answer any of your questions. So that opportunity is available to any of you that might want that is to just have a little time that we can actually chat one-on-one and speak specifically to what your organization does. And I only have one other thing to say that isn't on that topic before we get going.
Keep going, Jody. The floor is yours.
Okay. Okay. So we have been, Pete mentioned, rumors of a MOTS replacement. We've been receiving information from or inquiries from different providers, different staff at your organization that may be attending different meetings or different things with the state or different county stakeholders or CCOs. And, the rumor is, MOTS is going away. You don't have to report anymore. And as Pete mentioned, that is not the case at the moment. MOTS is still here. You will still need to report based on the guidelines until you receive further notice. We are looking at a replacement system, and everybody will, as we move forward, if that's the decision, our team will be actively involving the providers, our stakeholders, getting input, letting you know all the way as we go through this. So there won't be any surprises or just out of the blue, you've got to do something different in the next, week. We're going to collaboratively be working with everyone if that is the decision and direction that's finalized. So I just wanted to throw that out there to kind of let anybody know if you're hearing this through your other people at your organization. Again, reach out to MOTS support and us, but MOTS is not going away. And if it is replaced, we will be collaboratively involving all of you along the entire process.
And if I can just throw in there, as we move forward to a newer system, if that's what happens, the reporting requirements aren't going away. So we'll just be working with you at ways to transition you to the new system. So, new or not, all of these reporting requirements are hard set and are not going away.
Correct, Lyle.
Yeah, thanks. Wow.
It's not death and taxes, but it's pretty close, right?
Exactly.
Okay. Thank you, everyone. One of the things that I wanted to show in the Q&A is, and Mark mentioned, Mark is a coworker who likes to attend these, and this goes to that's not the site I wanted to show. This is the site I wanted to show. Sorry about that. The Oregon Health Authority Measures and Outcomes Tracking System. We have our site, and on our site you have the option to contact us. We have information about training. We have client entry online training. As I said, the new, a lot of turnover, new people coming, data requests and corrections. Justin talked about that, about how to request data corrections, and it gives you the option, and it gives you the data correction request spreadsheet. And if you click on it, it just clicks open with Excel, and you have your spreadsheet. There's a link that you can send us to, types of corrections, all that information, communication that we do. We have our newsletters that you can see and review, and we just recently put the January out there. We have a lot of other links that we have available, resources and frequently asked questions, and the resources are a lot of the documentations, a lot of the manuals, user manual, user guide, the reference manual for EDI, and all this stuff that's all out there. So I thought I'd pop it up because that's one of the pages that we, one of the links that we'd like to give to you. As I said, the other one, mots.support at dhsoha.state.or.us, is always available. As Lyle mentioned, Mary and Cecilia are constantly watching it. We are currently acquiring new staff, and maybe some of them might take part in this process, because in the past we've had support staff that also took care or helped out whenever possible, or whenever necessary, because people get sick and on vacations and stuff. So things rotate, and different people do different things, which is kind of one of the fun things about my job that I like, is that it has a lot of variety and different things come on, as we all know, as we all try to work as a team. So mentioned before, recording will be on our website. The messengers and future webinars are going to be on there. And the next one, which will have focus more on electronic data interchange, will be on March 2nd on 2022. Still no classroom trainings, but we do have our online training. Myself and Lal do a demo that takes about an hour and a half, depending on how many questions there are. Or you can go to our website, the one at the bottom, and you can do the online training, because Justin did a great job on creating 10, 15-minute YouTube videos where he kind of walks through and steps you through each individual part of the system. There's a client profile and a behavioral health part, and the crisis separate. So everything that you think needs a focus, you can go in there and watch a video that's about 10 minutes, and you can kind of stop it and check it and go back and forth. And they're very helpful, and they're very, very nicely done. So, okay, I'd like to thank Jody, Lyle, and Justin. And are there any more questions that I should bring up that I missed or that just popped up? And I'm not hearing any. Yes?
So the only thing is somebody's asking where can they get signed up for the newsletter? And wouldn't that be best to have them contact MOTS support? I'm typing it in, but I think and they can find a way to get them on a list. Is that correct?
Yes, that's the best way.
Okay. All right. Make
Cool.
sure. I thought so.
Excellent. Cool. Well, thank you very much.
I think, I think that's it.
That's it? Great.
That's it.
Okay. Again, thank you very much, everybody. This is the end of the webinar, and have a wonderful rest of your day.